And the other part that's amazing, now I focus primarily on the pain treatment part of all this. And my patients are having really good results. So I've been a registered nurse for 17 years. I did several of the first years in a hospital, like most nurses do. And I do think that's a good place to start because there's a lot to be learned with that. And there's a lot that you need to experience before you're actually a good nurse. When you're a baby nurse, you need to get some education. But once you grow into a seasoned nurse, it seemed more fitting for me to get out of the hospital. I knew that was not where I was going to end up. I'm a very good bedside nurse, but it's not my passion. It's not what I wanted to do. I wound up leaning more into occupational health nursing. And I actually was an on-site nurse for Concentra. I didn't work at Concentra, but I worked for Concentra. So I did a lot of traveling. Instead of the businesses sending their employees to Concentra, they would send the nurse to the business to do all the flu shots or drug screens or anything like that. So I preferred being out of the hospital for sure.
Gotcha.
I got a specialty certification in occupational health nursing, which nobody knows what that means, but that means that you work at a company like DuPont or Siemens, and you only work with their employees. So it's like being a school nurse for grown-ups at DuPont.
Gotcha.
And it's kind of a princess job. I mean, there's chemicals and there's emergencies, but mostly you're just sort of doing hearing tests and phone calls and computer stuff. Monday to Friday, 8 to 4, no weekends, no holidays, no on call. So as a nurse, that was a good benefit. But it wasn't very rewarding. Kind of stuck in an office all day. I didn't even have a window. I couldn't tell you if it was raining outside. And all of that affects my happiness and my well-being. So I started doing this mobile pain program bought my machine in December, but I didn't start treating patients till the end of January.
Gotcha.
It's amazing. I don't even know what to say. It's amazing. The results my patients are having are amazing. Now, when I was the nurse showing up to get drug screens or give you an injection, nobody was happy to see me. Everyone was like, oh, that nurse is here. She's going to do something I don't want done. But now my patients are happy to see me. They greet me at the front door like I'm their best friend. They welcome me into their home. They give me little gifts. Here's tomatoes from my garden. I have chickens. Here's some eggs. I made some homemade jelly from dandelions.
Oh, wow.
So, yeah, I have one lady who packs me little snacks.
Oh, my gosh.
Are you going to another patient today? I packed you a snack and took me a little bag of cherries or Rice Krispie treats.
That's amazing.
That part of it is amazing. That part of it is absolutely amazing. And the other part that's amazing, now I focus primarily on the pain treatment part of all this. And my patients are having really good results. And in addition to them being so happy to see me, the things that they tell me, like, oh, I was able to do this again. I was able to walk my dog again. I was able to go to church again. I haven't gone to church in a year and a half, but I went to church last week. I was able to, I have one lady, she's 77 years old, God bless her.